Hi there, in this video, I'm going to show you some simple home remedies that you can use to swelling in legs. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. If you've ever dealt with edema, you know how inconvenient it can be. Edema is swelling in the legs, ankles, and feet that is not caused by an injury. While this illness is not life-threatening, it can cause discomfort and may indicate a serious health problem. You've come to the correct place if you're looking for home remedies to cure edema in the legs and feet. What exactly is edema? Edema is the accumulation or expansion of interstitial fluid in organs or tissues. Because of the force of gravity, it is most common in the feet, although it can also affect the arms, face, hands, and abdomen. Edema is a frequent pregnancy side effect that can potentially be an indication of more serious conditions such as liver failure and cardiac difficulties. This syndrome can also be caused by malignant and inflammatory disorders. People with heart failure, kidney illness, cirrhosis, or diabetes are also more likely to develop edema. The best home remedies for leg and foot edema. We've compiled a list of the best techniques to reduce edema in your legs and feet. Keep hydrated. When you don't drink enough water, your body stores it instead of excreting it through urine or sweat. This response causes edema. If you have edema, you need to drink at least 8 glasses of water every day to get rid of it. Avoiding alcohol is also a good idea. This is due to the fact that alcohol dehydrates the body, forcing it to eliminate fluids from the circulation at a higher pace than other liquids. Fluids pass via your renal system, which is comprised of your bladder, ureter, and kidney. Bathe your legs with salt water. Edema can be effectively treated with Epsom salt. Because it pulls toxins from your body and aids in relaxing, salt is a good treatment for leg edema. To prepare a salt bath, dissolve a cup of Epsom salt in a bathtub filled with lukewarm water. Then soak your legs for at least 20 minutes in water. Remove suspected food allergies. If you have swelling in your body, it could be due to food allergies. Dairy, soy, maize, and wheat are some of the most prevalent food allergies. Try avoiding these foods for a couple of weeks and see if you notice a difference in how you feel. Purchase compression socks. Compression socks function by continuously providing pressure to your legs and feet. This pressure keeps fluid from building up in your legs. Compression socks can also help avoid blood clots. Compression socks are easy to acquire in your local drugstore or online, and they come in a variety of weights and compressions. Start with compression socks with a mercury range of 12 mm to 15 mm or 15 mm to 20 mm. Get yourself moving. Exercise is essential for preventing edema. Exercising helps your muscles perform effectively, which encourages normal blood flow throughout the body. Avoid sitting or standing for long periods of time as much as possible. Instead, get up and walk around frequently, or try extending your legs. Reduce your salt intake. A high salt consumption is harmful to your health. It causes the body to retain fluid, which causes swelling. Reduce your intake of processed foods, such as fast food. Instead, flavor your food with herbs and spices if you're cooking at home. Consider lymphatic drainage. Lymphatic drainage massage relieves water retention by manipulating specific parts of your body to enhance the passage of lymph fluids. You can utilize lymphatic drainage massage techniques such as the one-way pump, lengthy stroking, and kneading. These massage treatments employ either your hands or equipment to pump or massage your legs' lymph nodes. Raise your feet. Edema is a symptom that your body is holding too much fluid. Elevating the legs and feet to stimulate fluid evacuation is one of the finest home remedies for treating edema in these areas. Prop your feet up with a pillow or footrest to accomplish this. When feasible, try to keep your feet elevated for 30 minutes to an hour. Wear comfortable clothes. Wearing garments that are overly tight or constraining is not a good idea. Wear loose clothing that does not impede your movement instead. This makes it possible for lymph and blood to circulate freely. It is also advised to avoid wearing constrictive footwear. Instead, walk barefoot or wear flat sandals. Magnesium supplements or magnesium-rich foods are two options. Magnesium insufficiency is one cause of edema. There are various forms of magnesium supplements on the market. There are supplements that dissolve in water or that come in tablet form. It's also a good idea to eat more magnesium-rich foods like dark green vegetables and legumes. Maintain a healthy weight. Being overweight or obese is a significant risk factor for developing edema. Losing weight if you are overweight will help minimize edema in your legs. If you are overweight, consume a well-balanced diet and exercise to burn off the extra calories. Increase your potassium consumption. A healthy potassium intake might also aid in the relief of edema. Bananas, sweet potatoes, beans, and spinach are just a few examples of potassium-rich foods. Supplements are another simple approach to enhance your potassium consumption. Potassium supplements are available at your local drugstore. When should you go to the doctor? Consult a doctor as soon as possible if the swelling is accompanied by fever and pain, if the pain worsens over time, or if the edema is accompanied by swelling of your face or body. Remember that edema can be a symptom of a variety of disorders. As a result, if you have pain or swelling and are unable to alleviate it using the best home remedies to treat edema in the legs and feet, consult a doctor to be evaluated and treated. Last thoughts. Edema is not a life-threatening condition, although it can be extremely painful. Fortunately, there are numerous simple home treatments that might help to reduce this issue. Taking care of oneself by exercising and eating a nutritious diet is the key to preventing edema. Once conservative measures have been exhausted, it is important to consult a vascular expert who can determine the underlying reason of the swelling. It's possible that blood isn't being drained adequately from their deep veins. What can we expect from CVM? Our objective at the Center for Vascular Medicine is to serve patients with vascular disorders in a cost-effective and compassionate manner. We specialize in venous and arterial illnesses of the legs, foot, and pelvis. Our world-class specialists are the most skilled in the field, and they collaborate with patients to create a treatment plan that is suited to their specific condition. Typically, this process begins with an initial consultation followed by an ultrasound scan at one of our sites. Our experts will discuss the results of your scan with you and help you decide on the next steps after evaluating the results of your scan and taking a comprehensive medical history.